Hi guys, my name is Caitlin. I'm currently a student at the University of Texas at Tyler in the occupational therapy program. I'm just going to be making a little video on a craft that I really like to do for stress relief. I think that this is something that you can incorporate into your life if you need a new idea for a de-stressing activity, or with your patients or your clients. I think that's something that you could easily upgrade and downgrade to tailor to every individual. I really like to do this with my patients a lot. I think that it's really important as an OT practitioner to remember the mental health aspect of treating people, and that I think sometimes we get caught up in the physical aspect of rehab. I work in inpatient rehab right now, so that's where I'm coming from, but I think we get caught up a lot in physical activity, physical aspect, what a person can do, what they can't do, and we kind of forget about the mental health aspect, like the holistic approach, which is kind of how OT all started in the first place. So I try to, whenever I can, bring in a craft or something fun to do, just to kind of take their mind off of the fact that they're maybe in pain or they're not able to go home right now. Nobody likes to stay in the hospital. So something that I run into a lot is some of my patients, they used to sew or they used to crochet and they can't do those things anymore. So I try to find other ways to incorporate, yarn and sewing and things like that in a different way that they are able to do. And something that I found that a lot of them like is these little yarn pumpkins. So this is a finished one that I've already got finished, and this one, it's finished as well. So what you'll need for these are little foam pumpkins. You can get them, I got like a whole bag of these at Hobby Lobby for $6, I think. You can get them at the dollar store, the Dollar Tree. Walmart has all different sizes for under $1. You'll need yarn. Any kind of yarn is fine. This size yarn is probably the cheapest that you'll find, but it is kind of small. So if you are working with somebody that isn't able to grasp something this small or thread it, you can use something like chunkier. This is a little velvet yarn and it's a little bit thicker, and then this one is even thicker, so you can kind of see it's easier to manage. And then you'll also need a pair of scissors. You'll need an apple core, or this is like an apple core, also a potato peeler. And then a yarn needle. And so this is what it looks like in the package from Hobby Lobby if you get these. Then they come in different colors, so I try to buy the bright colored ones because they're easier to see. But they're just a really big thick needle that it's easier for a lot of people to manage. Okay, so to do this, sometimes I have to do this for my patients. Sometimes they can do it by themselves, but you just want to take the apple core and you want to take the center out of the foam pumpkin. And these actually just have a stem. I try to buy them with a stem. It just comes out and you can put it back in when you're finished. And it kind of makes a mess, but you want to make a hole in the center of the pumpkin. And it needs to be a little bit bigger than you would think, because as many times as you have to wrap the yarn around, it starts to fill it up and makes it hard to get the needle through there. And I'll flip it over and do the same thing here. So I think this activity is really good for mental health, just because it's kind of fun and a way to, working with geriatric patients, it kind of gives them a way to do something that they used to like to do, like sewing. A lot of people, I feel like, they get upset if I ask them about their hobbies, you know, I'll say like, what are your hobbies, or what do you like to do? And they say, well, I used to do this, or I used to do that, but I can't do it anymore. And they might not be able to do that anymore or get back to doing that anymore. So I think this is a really cool way to, you know, adapt it and let them do something similar whenever they've kind of given up on trying to do it again. Okay. The styrofoam makes a really big mess, so I usually try to keep a wet paper towel nearby to kind of clean everything up. Okay, so once you have the hole cut in the center, you're going to take some yarn. I'm going to use the thicker yarn just for the purpose of this video. So I like to take maybe 3 to 5 feet of yarn at a time because it's easier to manage and it doesn't get tangled up as much. Cut off a long string, and then you're going to thread it through the needle. Give yourself a little tail like that, and then you want to take it through the pumpkin like this. Tie a knot at the bottom so it stays. Now just cut off the extra. Okay, and then once it's tied on a knot like that, you just want to find the other end and thread this other end through the needle. Give yourself a little tail there so you don't lose it. And then you just want to go through the center of the pumpkin. You're basically just wrapping the pumpkin in yarn over and over. So pushing through the center, pushing all the yarn through. You just want to go round and round. Once you get the string that you have cut, once you get that all wrapped around the pumpkin, you can tie it off, or if you have a little bit left, you can thread it through the center and pull the needle through and just let the whatever's remaining stay in the center of the pumpkin. But each time you start a new string, you're going to want to tie a little knot at the bottom so that you don't lose it when you're pulling it through. Sometimes if my patients are still able to sew and do things like that, you can have them actually make like a chain of crochet and they can wrap that so it gives it a different look, or just, you know, upgrade the activity. And if you're working on fine motor things as well, you can also buy a smaller needle, buy a bigger needle if you need to. And these needles are not sharp, so if you're worried about safety, they just have a dull end on them like that. Just gonna keep going through. And it takes longer than you would think to actually get this finished. So I buy these really small ones, because if you get to a bigger size like this, it could take quite a long time. Okay, so you're just gonna go all the way around till it's covered. I'm not gonna finish this one while I'm filming just because it's gonna take too long, but that is how you get it going. And then whenever it's done, it would look like this. And so whenever you get it finished, just tie it off at the bottom and then cut the tails off. These pumpkins that I bought came with a little plastic stem like this, and so you're able to just pull it out before you cut the hole. And so I'm just gonna stick this back in here and use that stem for my finished pumpkin. If it doesn't come like that, or it's just a foam pumpkin with a foam stem that needs to come off, you can also just use a stick, which is cute. This one's a little work in progress, but you can just take a stick and you can glue it if you want to, or you can just try to fit it inside like that and use a little stick. I sometimes also like to let patients go outside and collect sticks. It's nice also for your mental health to get outside. I think that that's a big problem that I see a lot too in an inpatient rehab setting is, you know, people are stuck inside. They don't get to go outside as much as they're used to, and people need sunlight. So I like to do that. And even if we don't use the sticks, you can also go outside and do the craft. It's super easy. There's not a lot of supplies. You can do it anywhere. So this is what it looks like finished. I'll show y'all these again. But yeah, so there's a lot of ways to incorporate this into therapy for mental health activity, and also working on, you know, goals that you might have for the patient. And I think that crochet is something that has helped me a lot, actually. I know it kind of, you know, people laugh at me because they say I'm young and I crochet, and, you know, I think that, you know, it might be stereotyped as something that older people like to do, which they do, but I think it's something, you know, if you're looking for something to de-stress or a new activity, something to try, I would say give it a try, because it has helped me a lot whenever I've been stressed in the past. So anyways, I hope you like this. If you have any questions, let me know.